I'm really excited to talk about this on this topic. I put up this next slide. Did it go? Let's see. There we go. I put this next slide, which is a quote from Groucho Marx, because when I went to vet school, I was one of the older people, and I had no previous vet experience. And so my best friend in vet school had a geriatric dog, and she was kind of lamenting that we really weren't learning much about geriatrics. And I was like, I love learning all those new sexy diseases in other animals, and I didn't really appreciate how different our geriatrics were. So I was like, yeah, just getting old, it's just age. But now, being an integrative veterinarian that primarily focuses on Chinese medicine, so acupuncture, herbs, food therapy, the bulk of my practice are geriatric animals and senior animals. And I love working with them, not the best business model for growing a practice, but certainly one of the most rewarding ones. So let's move on. So let's cover the semantics, because senior and geriatric are really not synonymous terms. And there's no real hard and fast rule for what is a senior and what is a geriatric. But basically, if you look at the 2019 AHA Canine Life Stage Guidelines, they're saying that dogs, it's basically the last 25% of their estimated lifespan through the end of the life. And with cats, according to the 2021 AHA and AFP Feline Life Stage Guidance, they're saying greater than 10 years of age. So typically our seniors are somewhat healthy, but they may be showing clinical signs of aging. Geriatric patients are older and they tend to have more health-related problems. Interesting enough, according to the AVMA, they're saying in general, cats and small dogs are considered to be geriatric at 7 years of age, and for larger breeds of dogs, 6 years of age. And I'm like, I don't really quite agree with that, because it's kind of scary thinking that, you know, my big 90-pound dog would be geriatric at 6 years of age. And the AVMA also does not make a differentiation between senior and geriatric. So I think this just highlights the fact that I'm hoping senior and geriatric medicine will be something that will become a little bit more of a focused practice in the future, and we'll have more and more research that will cover the disease processes that our older animals encounter. So recently, the American Animal Hospital Association and the American Association of Feline Practitioners reduced the division of lifespans into 4 life stages for both our dogs and our cats. So the first life stage is going to be puppies and kittens. Then we have young adults, mature adults, and seniors. The 5th and final, which is the terminal stage, is at the end of life and is going to be dependent upon the specific pathologies. So I always like to joke and say, when we're talking about senior and geriatric, this is when size actually matters. And so I did actually change the ages on this slide versus what you have in your handout. The original handout is going to be more following what's on the next slide, which is a chart by Fred Metzger, who's a DVM DAB VP. And I tend to agree more with this chart, which is the IDEX chart. So seniors for our small animals are going to be 10 years, geriatric 14, because we know they're going to live longer, right? That's our predicted lifespan is going to be longer. Dogs that are going to be about 20 to 50%, they're considered seniors at 9 years and geriatric at 13. And then our larger animals, our 50 to 90-pound dogs, considered seniors at 8 years of age, geriatric at 11. And then our giant dogs are going to be considered seniors at 7 and geriatric at 10. And then this age chart, this one is very easy to find on the internet. It's been used for a lot of different websites as well. So I thought it'd be interesting to take a look. And as I said, for me, I was kind of going like, I don't know. I kind of don't think that, I think it should be a little bit more, you know, I feel that my older and bigger dogs, I go more with the chart that we have in the previous slide. So this is what we all heard in vet school, right? Aging is not a disease. No, it's not a disease, but it is a set of complex physiological processes that are progressive and irreversible. And basically, aging is pre-programmed cell death, right? Or just in general cell death. So what are the things that we'll see? We have impaired circulation. Our cells die or are destroyed faster than they're able to regenerate. And this can lead to decreased organ reserves as well as decreased functional capacity. Our animals also have an inability to maintain their homeostasis, and they're unable to mount an appropriate response to stressors that are either internal or physiologic, or external, which would be environmental stressors. And so that's why when we have an older dog, they're going to be more susceptible to things like, when it's really cold in the winter, so hypothermia or hyperthermia in the summer in the hot areas. Maybe they're not able to handle the stress, emotional stress, right? Of all of a sudden I'm losing vision, I'm losing hearing, and my mom or dad are gone all the time. And so now we have a stressier dog that starts exhibiting behavior issues or even starts having gastrointestinal issues. Also with age, we unfortunately see a decline in our immune system, and that leads our animals as well as ourselves to increased vulnerability to disease. And then that, of course, we have decreased viability, which therefore will lead to death. So why is aging important? Well, first off, the lifespan of our companion animals is increasing, and that's going to be in part advances in medical care. So with technology, we have things like surgery, diagnostics, therapeutic devices, so all new advances in that. We also have more treatment options, right? So we have not just new medications, but also repurposing old medications, as well as looking to other medications for other uses. We also have earlier diagnosis, in part to better technology and better understanding of our disease processes. And when we have an earlier diagnosis, we oftentimes have a better outcomes in terms of because we can catch the disease process earlier and hopefully turn things around or at least slow them down. We also have better management and control of infectious diseases and chronic diseases. One of the things that I think is very important, because I think nutrition is just such a foundation for health, period, is we have a greater knowledge and understanding about nutrition, and what we consider appropriate nutrition is evolving. And I think it's a very exciting time for all of us right now to be involved in the health sciences. We also have a diversity in veterinary services offered, right? So our standard Western or allopathic medicine, we talked about, we already have advents in technology and other treatment options, but there are also more and more holistic or alternative modalities that are being accepted. And then, of course, integrative, which is where we're going to be using a combination of our standard Western medicine in tandem with alternative modalities. So the dog up on top is a patient of mine. She is a dog, a Rhodesian Ridgeback, that was diagnosed with high-grade gastrointestinal lymphosarcoma when she was 4 years old. That was back in 2016. She was only able to go through about 75% of her chemotherapy protocol and was treated supportively with alternative medicine during that time. And ever since she stopped, we have been treating her with alternative modalities. She's now 9.5 years old and disease-free, which I think is a really exciting thing. She's just in great health, robust, running through the mountains. All right. Another thing that's important is that there's a changing view of companion animals. And so there's a greater recognition of the benefits of animal companionship. So we know physiologically there are benefits to animal ownership. So the American Heart Association said that dog owners are about 54% more likely to get the recommended amount of exercise than their non-dog owning counterparts. And that's partly because we are more apt to take our dogs out, right, to exercise with us when we have dogs. And that will lead to decreased blood pressure, cholesterol levels, triglyceride levels, and that will also decrease the risk for heart disease. I kind of tend to put emotional and psychological together, but the benefit of our animals there is going to be a decreased feeling of loneliness. Again, if you have a dog and you take your dog out for walks, that's going to give you more chance encounters to socialize with other people. The American Humane Society said that dog owners are less likely to be depressed. They have higher levels of serotonin and dopamine than non-dog owners. And the thing I think is most important is our animals, be they dog, cats, or fish, even birds, that they help us to have a reduced level of stress and anxiety. And for those of us that have dogs, I think that we have that added extra feeling of protection. I know with my big German Shepherds, I leave work very late, and so I feel quite safe having my dogs here and leaving at all crazy hours of the night and early morning. There's also a changing dynamic of the human-animal bond. So we have shrinking households, and in these shrinking households, our animals tend to play a greater role in terms of not only companionship, but also kinship. There's also urbanization. So not as many people are living out in the beautiful country where maybe the animals are having a greater, more apt to be wandering around out on the ranch in the fields. A lot of people tend to think of themselves as pet parents and their animals as fur babies. That's another way that people are kind of expressing their greater connection to their animals. And then the management consultancy company EY Parthenon did a 2017 survey back in February and found that 72% of Americans consider their pets to be family, and that, was it 96% said that they let their pets sleep inside the house, and then 32% said that they let their pets sleep on a human bed. So aging and the aging changes in our companion animals is important because it also affects the quality of our lives, not just our animals. So you can see the young family on the left has got a nice young golden, and they can take that dog, put that leash on and go for a nice walk. Whereas the older shepherd on the right, she's got canine idiopathic vestibular disease, probably also has either, IVDD to some extent, or potentially degenerative myelopathy. And this is a dog that, you can't just put a leash on and take her for a walk. She needs assistance. She has to go slower. So definitely having a dog like that is going to impact your lifestyle as well. So there are many factors that influence the rate of aging, right? Because we're all obsessed with trying to slow down aging, be it for ourselves or for our animals. There's definitely a genetic component, but there's also a breed component, right? So in general, and I believe I found it in the nutritional book, but we all kind of take it to be truth. Mixed breeds tend to live longer than our pure breeds. And I think Sean Delaney, who's a nutritionist, said that, I believe it was in their nutrition book with Andrew Fischetti and Sean Delaney. But breed is not just the only thing that we have to look at, right? Because you've got to look at breeding. So you can have the same breed, but different lines that might have better longevity. One of my neighbors always had boxers, and he said Madeline boxers only live to be 8. And I'm like, they're not a large dog, they should live longer. And every single boxer he had, even though they were from different breeders, would die at about 7 or 8, and it just befuddled me. Size, like we talked about in the earlier slides, makes a difference. Our larger animals tend to have a shorter lifespan, while our smaller animals usually live longer. That beautiful, handsome Great Dane there lived to be 10, and he was just a wonderful, lively dog up until probably about 9 or 10, and then fortunately the hind end and aging just got to him. Lifestyle and environment will also affect aging. So if you have a lifestyle, or the animal has a lifestyle where they're not getting out exercising, I anticipate that they're going to have a shorter lifespan. Or if they are stressed, either physically, so for example, you've got a dog like this beautiful Dane here that's in a really cold area, like a snowy area. We don't have a lot of hair coat, so he's going to be always, on the colder side in the winter. Or you get that husky or that Malamute that's here in Davis where we have triple digits. That's going to be an environmental stress for them as well. But also just the stress level in the household. So if the family is in an uproar or in an upheaval, that can be very challenging. I could see in my own patients, I had a couple that had a dog they were very bonded to. Whenever they would fight, I would see it in their dog. I could just look at their dog and I would know they fought. So let's not forget that stress not only affects the humans in a household, but also our animals. Nutrition, if they have an inappropriate diet, and we all have different ideas of what is and is not an appropriate diet. So let's just say that if you have an inappropriate diet, that will certainly lead to aging in all of our animals. And also the health status, right? So health status is disease state. So if an animal has a diseased, let's say, organ system like heart or kidney or liver, we know that they're going to be aging faster than an animal that does not have a diseased organ. And then finally, body condition score. I think we're all pretty much familiar with the Purina 2002 lifespan study, where they did a lifelong canine diet restriction study, and they found that the median lifespan of the labs in their study was extended by 15%, which is about 2 years, when they had a restricted diet to maintain ideal body weight. Additionally, they had found that the control dogs had more visible signs of aging, such as graying muzzles, impaired gaits, reduced activity at an earlier age than the leaner dogs. So what do we see in humans? The geriatric giants are considered to be immobility, instability, incontinence, impaired intelligence or memory. Some of the other things are going to be delirium, multiple medications, polypharmacy, impaired vision, and hearing. So in the vet world, the AVMA says the common senior pet diseases are going to be cancer, heart disease, kidney, and or urinary tract disease, liver disease, diabetes, joint or bone disease, senility, and weakness. So what do we see? Okay, and these are alphabetical. I didn't do them in terms of what I think is more prevalent. But arthritis, right? I mean, we all see arthritis on a daily basis. Behavior changes. So we see cognitive disorders. A lot of times we'll see dogs that are depressed, right? It's not necessarily energetically lethargic. It's just there's a depression going on. Also inappropriate urination and defecation, which of course is going to be different from incontinence. We see a lot of cancer, also dental oral disease, endocrinopathies such as Cushing's, diabetes, hyper or hypothyroidism, and more. Also gastrointestinal issues, inappetence, incontinence, be it fecal, urinary, or both. And then also a greater incidence of infections. So both pyoderma, urinary tract infections, maybe upper respiratory infections. We'll see internal organ dysfunction, so heart, kidney, liver, a lot of mobility, weakness, instability, and then sensory deficits, so decreased vision, decreased hearing, maybe even totally deaf, and then in some cases decreased ability to smell or to consciously recognize smells. So we can go, let's go specifically. So among our age-related changes, we're going to have maintenance energy requirements change. So first and foremost, we can often see a decreased physical activity, but along with that comes body composition changes. So there's a reduction in lean body mass as well as bone mass, an increased proportion of body fat, and reduced total body water. So lean body tissue is about 73% water, where fat is about 15% water. And the maintenance energy requirements typically decrease in dogs. Interesting, so we should be actually reducing the amount we feed our dogs as they get older. However, interesting enough, in cats, the energy requirements increase. And so according to the 2021 AHA and AAFP feline life stage guidelines, they're saying that we should increase their intake 10 to 20%, perhaps as much as 25%. So I'm sure a lot of you in your geriatric and senior patients will see a decreased appetite, right? So sometimes it's an issue of they have a decreased sense of smell, or they're not as interested in smelling. It could be visual, right? So they don't see the food, so they don't think about it. So out of sight, out of mind. Could also be taste, because the number of taste buds decrease with age. There can also be non-sensory reasons why they have a decreased appetite. So they could have periodontal issues. Look at the dog on that. That was actually a patient of mine. It's like, I'm sure you guys have all seen worse trench mouth than that, but I thought that was pretty profound. They may also have an inability to stand to eat, right? So their hind end is weak, and so they just can't stand there for a long time. They may also have cervical problems, so they're unwilling to bend their head. And they may also have a learned taste aversion. So learned taste aversion, if you don't remember, is where they eat something and then something adverse happens. And so they associate that adverse event with that particular food or that taste, and then they're like, I'm not eating that anymore. So one of the things that I find in my geriatrics very common is that they may not want to eat breakfast. They'll usually eat dinner and perhaps brunch. So I'll tell my clients, if they don't want to eat first thing in the morning, try and feed them a little bit later. One of my own personal dogs, she just needed a change in venue. She didn't want to eat with the dogs in the kitchen because she felt that they were help. So she would eat her breakfast or her dinner. She would be happy to eat it in the dining room or in the bedroom with us. So that's something else that I'll tell my clients who have geriatric dogs that just aren't so interested in eating. Digestive tract changes. So it's common to see periodontal disease. So we'll see an increase in the dental calculus and tartar, gingival hyperplasia, periodontitis, gingival recession, and bone loss. There's also an increased occurrence of oral tumors. So we'll see melanoma, fibrosarcoma, squamous cell carcinoma. The dog on the bottom right, you can see the little red circle. This was a lovely lab that we were treating for arthritis, and then a little black oral mass popped up. And 12 and about 3/4, so 12 and 3/4 of age, she was diagnosed with oral melanoma, had the first one excised, and didn't do other treatment because of the dog's advanced age, and she had some advanced arthritis. She did get another recurrence in that area, but she finally died at 13 and 3/4 years of age. So despite disease, she still lived another year after that. We also have a decrease in pancreatic enzyme and bile secretion. So that can be an issue in terms of the ability to further break down their food. So digestive tract changes. This is what I thought was really interesting, because in Chinese medicine school, we were taught that with age, you're not able to break down your food and utilize it as well. But the studies that I looked up were all saying that there's minimal to no decrease in digestive function despite the age-related changes in the enteric neuro system. And there's also some enteric physiological changes, but they didn't seem to really have a big impact on digestive function. So I did list the 2 studies that I was reading about that. But in cats, there's a decreased digestibility of nutrients, especially fats and proteins, after they're the age of 11 years old. So I thought that was quite interesting that there is that difference between our older dogs and cats. So we also have immune response changes. So there's going to be an increased incidence of infectious diseases and neoplasms, and we know our immune system is going to decline with age. There's also sensory decline that we talked about earlier, hearing, vision, smell, and taste. And we don't know, again, if that decreased sensory smell or taste is due to lack of interest in smelling or sniffing. But we also will see that increased startle response, and almost hyperesthesia, right? So is that because they have a decline in hearing or decline in vision, or is it just that neurological input to the brain is a little bit slower, and so they have that hyper and slower startle response? In the integument, we'll see changes in the skin, so there'll be loss of elasticity and pliability. We might see nasal and paw pad hyperkeratosis, so that drier, thickened nose pads as well as on the foot pads. Hair coat, we'll see textural changes, right? So how many of you have noticed that dog that had that wonderful, soft, fluffy, silky hair coat all of a sudden, becomes a little bit drier looking and duller looking? Well, that's because we have decreased sebum production, and the sebum that is produced is a little bit more waxy. And so that hair coat becomes dry and dull and kind of lusterless. We also get follicular atrophy, so we may get some patchy alopecia. And there's also atrophy of the pigment cells in the follicles. And we also have decreased tyrosinase activity. So remember, tyrosinase is that key enzyme of melanin biosynthesis. So that's how we get those gray faces, gray muzzles, and gray facial hair. That's one of our patients that she was super sweet dog, and then you can see that graying of the muzzle and the head. Also, the hair texture can vary from surrounding areas, and we've noticed that. It's kind of interesting. And then finally, salivary and porphyrin staining. So the porphyrin staining can be due to more licking, right? And the licking of, let's say, legs or arms could be from pain, boredom, or stress. You may have increased porphyrin secretions due to allergies. You can also have from periodontal disease, and then you have the dogs resting their face on their legs, sleeping more, and now their legs get all red. Sometimes it's also the inability of the client to trim hair around the eyes, and so we get more tearing and tear staining. Nervous system. Well, as we age, our brain becomes chronically hypoxic. We may also see tremors or motor hesitancy, and then a longer response time to external stimuli. My own dog, when she was about 15, we would come into the front door and she'd be standing facing the wrong way, and I'd go, Roxy, and she was very hard of hearing, if not deaf, and she would ignore me, and then I would touch her on the butt, and I swear it would take her like 3 seconds to finally turn around and react, and of course it was like, oh my God! So don't be surprised if we have that longer response time to external stimuli. Behaviorally, we see changes, and I love that we're recognizing canine cognitive dysfunction a lot more now. I think it was something that we perhaps didn't really understand as well. Just like in human medicine, we're learning more and more about Alzheimer's. We're learning more and more about canine cognitive dysfunction. There's a really great article by Curtis Dewey that was recently published. I would recommend that you read that if you have the time. The dog on the right, this is a 15-year-old dog that we've been treating for about a year, and she's very fit, but she does have cognitive dysfunction, and sometimes she just stares off in space. When she first started coming to us, and we've been treating her, and she's improving, but she's also at the same time aging, and so it's kind of like, she makes a step forward and then she kind of falls back a little bit. Some of the other behavioral changes we'll see are depression and isolation. So sometimes our animals will just go, instead of wanting to be in the family room with us, they may want to go and be isolated where there's not as much stimulus, but also maybe they're painful and they want to just be left alone. In some cases, we'll see aggression. That aggression can be fear-related. So it could be, I'm painful, right? So I'm painful and now you want to touch me. And so I'm going to be fear-aggressive. And also, you can get aggression when the animals are surprised, right? So because they have decreased vision, hearing, or they're sounder sleepers, and then all of a sudden we touch them or we trip on them or a child grabs them, they become defensive. Musculoskeletal, of course, we know we're going to see degenerative joint changes, so both appendicular spondylosis. One thing that, because I went to school to do chiropractic in California, we're not allowed to say, veterinary chiropractic, but that's basically what we did, what we're doing. And I was fortunate enough to take a course out in Wisconsin, which was over 223 hours. And we didn't really learn so much about spinal health, but spondylosis is huge. I mean, I remember in vet school, we were like, well, it's typically not painful. But the important thing to me is I'm seeing that, if we keep better spinal health, our animals are going to be a little bit more vital because, we've got, nerves coming out of the spinal cord that are innervating our organs. And so spondylosis to me is now a big deal. And I really encourage my patients early on to get appropriate care, be it, veterinary spinal manipulation or acupuncture. We all see very commonly hind end weakness. You can see my old boxer friend there. That's how she would stand. And eventually with time, the elevator would go even lower, 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 lower. So that was a little bit challenging for her to eat. But hind end weakness is really common in our old patients. And we have great luck in most cases treating with acupuncture and herbs, and in some cases rehab if they're willing to do it. And we also have instability, right? So instability due to sarcopenia, also because there is going to be a decreased activity, and so there's that combination. But the instability, we see very commonly in our older animals as well. So, since my practice is heavy on seniors and geriatric, how do I manage my patients? First and foremost, we have to set realistic expectations. So the client coming in with the older golden on the right-hand side over on the other side of that window, we have to let them know you're not going to get your happy, healthy puppy back. And let them know that we're going to make some changes and some improvements, but you're not going to get that young, flexible, resilient puppy back. So what are the goals for our geriatric patients? We want to decrease the clinical signs of aging. We want to enhance the quality of life. Everybody wants to increase life expectancy. And then we want to either slow or stop progression of metabolic changes, and then delay the onset of diseases and dysfunctions. And I always tell my clients, when I've got a terminal and progressive disease, my best, if I can eradicate it, that would be great. That's like my gold ticket, right? But sometimes it's just going to be, halting it so it doesn't progress further, or maybe success is just going to be slowing down the progression of disease. So how do we manage our geriatric patients? Frequent monitoring. I require biannual or even more senior examinations. Most of my clients come to see me for acupuncture, so I see them on the regular anyway. But for the few that might be in for behavior, or might be in that they just, they live very far away and they can't come in for regular acupuncture, I still have them come in twice a year. If they can, I would like to see them 3 or 4 times a year, because things change so rapidly in our older dogs. And each time we update the history, because they don't always tell you. We ask them to keep us updated, but they forget. They forget that they've changed the diet. They forget that, the dog had a bout of diarrhea 4 times. So I always make sure we get an updated history, and I'll send out a questionnaire in advance to a client that we don't see regularly. Like if I don't see them at least every month, we'll send them a questionnaire. If I see them, twice a year. I do request lab work at least 2 times a year, and that's for my animals twice a year if they don't have any abnormalities. And so we do a CBC, chemistry panel, urinalysis, and other panels as needed, such as a thyroid panel, and other diagnostics such as ultrasound and radiographs. If I see any abnormalities in liver or kidney parameters, I do tend to recommend lab work more frequently than just twice a year. So the most important thing to me is client education, and that's one of the complaints I hear from clients that come to see us, because we have longer appointments, and so I explain how the disease progresses, and so sometimes they have to hear it multiple times, and then I like to let them know what the emergency signs are for that particular disease. So when do you know that you need to call your vet, like right away, if your animal is exhibiting that particular sign? I also, if they're on drugs, I also explain the side effects of drugs, and also of any of the herbal or supplement products that I'm using, if there are any side effects. And then I also let them know that there are other options out there. But I think the most important thing is to really educate your clients, because they're kind of, I think we all have that sense of, we see our animals age, and there's that little panic button that we also get as well, that's going to be us in 5, 10, 15, 20 years as well. And so just if you educate them, you empower them, and they're better able to understand what the changes are their animals are undergoing, and when it becomes an issue where we need to maybe intervene a little bit stronger.